Well, good news this morning in the fight against COVID. President Biden says 200 million doses of the COVID vaccine have been administered.
And he wants that number to actually grow. He's calling for bosses to help out so no workers will lose pay in order to get vaccinated. Take a listen.
I'm calling on every employer, large and small, in every state to give employees the time off they need with pay to get vaccinated, and any time they need with pay to recover if they're feeling under the weather after the shot.
The IRS will offer a tax credit to reimburse companies with less than 500 workers for the cost. Also, with all Americans over 16 now eligible for the vaccine, the president says those who have been waiting for their turn should wait no longer. The CDC reports over 26% of the U.S. population is now fully vaccinated. More than 50% of Americans have received at least one dose.
Well, doctors are learning that COVID-19 can do more to your long-term health than they even realize, maybe your vision.
Yeah, Marcela Cuadra spoke with an eye doctor to find out the signs you should be watching out for.
As COVID-19 continues to loom across the country with new variants forming, doctors are still unsure of the potential long-term effects the virus may have. But the question is, can COVID have an effect on your vision?
Coronavirus is a virus, and the eye is vulnerable to virus infection through the soft tissue called the conjunctiva.
Dr. Hart says one patient reported their left eye turning red and being sensitive to light while having COVID.
And it passed. As the coronavirus kind of waned, that eye problem passed. Their vision dropped a little bit, according to the patient.
He says the eyes are incredibly sensitive, which makes them susceptible to viruses.
I don't think there's anything special about coronavirus. Many viruses, like an adenovirus, so-called pink eye, cause the same sort of thing.
He says like any virus, if it enters through the conjunctiva, your eyes can get irritated.
You can have blurred vision due to inflammation inside the eye. You can have a little bit of discomfort of the eye. There can be swelling of the optic nerve in extreme cases.
For now, Dr. Hart says the impact of COVID on your eye is not conclusive.
There's not any studies being done. The one study that's being done was done by, I think, telephone and maybe by mail. So there's nobody really looking at the patients because everybody's been locked down.